So, welcome and good evening. Welcome to the new session of Pre-Med Pro. This is probably the last lecture of the cardiovascular system, that is the body fluids and circulation. We are going to end up with the disorders related with the cardiothoracic and the vascular system. But before that, we are going to study about the neural coordination on the cardiovascular system. So, let me give you a basic outline of the nervous system. So write the basics as the nervous system can be differentiated. The nervous system can be differentiated into two, that is the CNS and the PNS. CNS is the central nervous system, the central nervous system, while the PNS is the peripheral nervous system. Okay, so what you get is that the peripheral nervous system can be further differentiated into the somatic nervous system, while it is also differentiated into the autonomic nervous system. Okay, now the ANS can further be differentiated into the sympathetic and the parasympathetic. Okay, then now come to the point. This is by the medulla oblongata, that is the center in the medulla. Let this to be the center in the medulla. So you can say it. Let this is be cardio acceleratory center. This is cardio acceleratory center, while it is the center in the medulla, and this is be the cardio inhibitory center. That is it is also a center in the medulla. Okay, now what happens next? Let these be the two centers. These two are in the medulla. Okay, now what happens? This cardio acceleratory center acts on sinoatrial node, that is the SAN. Where the SAN is there, it is on the right atrium, right wall of the right atrium. Okay, the SAN, it acts on the SAN. Okay, and acts on the sinoatrial node via sympathetic part of ANS. It acts on the sympathetic part via the sympathetic part of the autonomic nervous system, while the opposite goes on to the cardio inhibitory center. Okay, so the cardio inhibitory center acts via parasympathetic, a branch of ANS on sinoatrial node, on the SAN. Okay, now it releases neurotransmitter. It releases neurotransmitter acetylcholine acetylcholine. Okay, it releases the neurotransmitter acetylcholine. Okay, now what happens? This part, so the cardio-acceleratory center releases. Here it is the neurotransmitter on the inhibitory center. So here for acceleration we require adrenaline or epinephrine. So here adrenaline or epinephrine. These are the vasoconstrictors, okay, or the ionotropes. Okay. And norepinephrine or noradrenaline. In case of septic shock or sepsis patient, we generally use the NORAD to increase the blood pressure of the patient, to increase the vasoconstriction of the blood vessel, so that the pressure gradually rises up. In sepsis patient, that is the patient which is undergoing severe infection, these patients are called the sepsis undergoing patient. Here we see a gradual fall in the blood pressure. Okay, the body fights with the germs or with the infection, so the blood pressure falls off. So to prevent the damage of the end organs, the vital organs, we need to add vasoconstrictor so that the blood pressure maintains in that critical patients. Okay, so in that case we use adrenaline or noradrenaline. Noradrenaline in short form we called as NORAD. Okay, now it increases the heart rate increases, CO increases. Now, okay, and in case of parasympathetic, heart rate decreases, cardiac output decreases. Okay, now come to the next part. Hormones can also control heart rate, thus the cardiac output. Okay, now the adrenal medullary hormones, that is emergency hormone, that is adrenaline and noradrenaline. Here the heart rate increases while the cardiac output also increases. Okay, now I am drawing a picture. Let this is the adrenal medulla, and this is the adrenal medulla, while this is adrenal cortex. Okay, now what happens? Adrenal gland is situated in the just superior portion of the kidney. It is also called the suprarenal gland. Okay, as it lies in the superior portion of the renal gland, that is the kidney, it is also called as suprarenal gland. Okay, now disorders. This is the main thing of this topic, the disorders. Please understand this because questions comes from this topic every year, and this is also required in your clinical life also. 1. Hypertension oblique high blood pressure that is BP. What is a normal blood pressure? Normal blood pressure 120 by 80 millimeter Hg. Okay, now the device used to measure BP is called sphygmomanometer. Okay, so in 120 by 80, this 120 is the systolic pressure, and this is called the diastolic pressure. So what is the systolic pressure? What do you mean by the systolic pressure? Systolic pressure is the pressure exerted on the arterial wall by the ventricles. Okay, and what is the diastolic pressure? Diastolic pressure, the pressure exerted on the arterial wall when ventricles are in diastole. Okay, if now what is hypertension? When you say the patient that you are hypertensive, so when in repeated blood pressure measurement shows 140 by 90 above mercury, we call this patient as grade 1 hypertensive. Several drugs used to vasodilate the blood vessel to reduce hypertension. Drugs are telmisartan, cilnidipine, metoprolol, okay. Many more loop diuretics can also be used to reduce the hypertension, but these are the common drugs. Okay, amlodipine. Okay, this cilnidipine. These are the calcium channel blocker. Telmisartan is ACE blocker. While metoprolol is beta blocker. Beta blocker reduces heart rate, thus reduces cardiac output. In this way this acts. Okay, these will be taught in pharmacology in MBBS. Now come to the next part. Take it as a note. Take it as a note. What? Due to high BP, most vital organs like kidney and brain are most likely to be affected. Okay, due to the rise of blood pressure, the vital organs like kidney and the brain gets affected. So the next disease in the Neet syllabus is CAD, that is the coronary artery disease, because in the syllabus it is said some disease should be briefly dealt with. Okay, so what is the coronary artery disease? When deposition of fat, fibers and cholesterols. Deposition of fat, fibers, cholesterol, calcium, etc. occurs in the lumen of coronary artery. When the coronary artery are being jammed with fat, cholesterol, calcium deposition due to excessive use of oils, butter, ghee, fast foods, sodium, this type of substance generally increases your cholesterol level, the LDL level. Actually, the LDL and the triglycerides level are being shooted up, if not checked. Okay, this low density lipids generally deposits in the arterial wall and thus makes the arterial passage narrower. So in physics, you have already known that the pressure depends upon the force per unit of area. E is equal to F by A. In that case, if the area of the arterial lumen gets decreased, the pressure increases, thus the blood pressure increases. As the blood pressure increases from the cholesterol, there is a chance of cerebral stroke, okay, and cardiac diseases. So in case in the lumen of the coronary artery, making the lumen narrow, okay, hence blood supply through it as well oxygen will be greatly affected. Okay, also known as atherosclerosis. That is the deposition. Three is angina pectoris. It is also called acute chest pain. What do you mean by the acute and the chronic? Acute means developed suddenly. Acute means developed for a long period of years. Okay, so these are the difference between the acute and the chronic. Okay, now this condition develop when enough oxygen is not reaching heart muscles. heart muscles. Okay, enough oxygen जब heart muscle में नहीं पहुंचता, ये acute chest pain होता है due to deficiency of oxygen. So CAD, coronary artery disease, is most common reason for angina. If the pipe gets deposited or gets clogged, the lumen gets narrower, then obviously the less oxygenated blood will go to the cardiac tissues, and hence the tissues will suffer from the lack of oxygen or the lack of blood. So ischemic heart disease also develops. Okay, so you will study about the ischemic disease in the medical, but know it, if the deficiency of oxygen, deficiency of blood happens, the tissue is dead. So we called it as ischemic condition. Okay. insufficient oxygen forms acute chest pain. Okay, now can occur across all age group, but common in middle or elderly people. Okay, now heart attack. What is the heart attack? When people goes and attack the heart. No, it's not heart attack. It's not like that. Heart attack. What is the heart attack? लड़की धोखा देके चल गया तो ये हार्ट अटैक नहीं है, ये अच्छा है, ठीक है. When continuous blood supply is not reaching cardiac muscle, heart muscle dies. Okay, so what happens? Heart muscle dies. That is called the heart attack. And what is the cardiac arrest? Cardiac arrest, multiple attacks leads to complete stoppage of heartbeat. In simple language, it is death. The death is called cardiac arrest. Okay? And what is heart failure? When the heart fails to pump sufficient quantity of blood, that is called heart failure in general. When heart is unable to pump enough blood to meet the demands of body, we called it heart failure. It is known as congestive heart failure. Okay, because one common congestion of lung, that is, if there is a congestion of lung, there's also accumulation of fluids in the lung, that is, we call this pulmonary hypertension. Okay, because one more common congestion in lung makes accumulation of fluids in lungs, we call it as pulmonary edema. Okay, since blood unable to pump out of ventricle, blood accumulates in the heart thus accumulated. I have discussed it in my previous videos about the pulmonary congestion and the pulmonary hypertension. It is accumulated in pulmonary vein and around lungs. It causes pulmonary edema. Result, pulmonary edema. Okay. So there is another thing. In this case, we generally require heart transplantation, that is of dilated cardiomyopathy, in which the ventricles of the heart gets dilated. Ventricles of the heart gets dilated. Treatment requires VAD, ventricular assisted device, ventricle assisted device, or permanent cure. Permanent cure is heart transplantation. Okay, so this is all for this chapter. In the next chapter, I will give some MCQs to practice from the respiratory system as well as from the cardiovascular system. So go through these two chapters. In the next video, I will give the MCQ to practice, and this will be very much beneficial for the Neet. Okay, so good night, and just go through go through whole chapter, and please subscribe our channel and please stay with us. Good night.